Welcome to Dr. Diaries. Today we're talking to dermatologist Dr. Alice Rudd. Alice is a general and cosmetic dermatologist affiliated with the Alfred Hospital in Melbourne and the Skin Health Institute in Carlton. Alice completed her medical degree at Monash University in Melbourne and pursued her postgraduate dermatology studies through the Australasian College of Dermatologists. She's also a qualified yoga teacher, woman of many talents. Welcome, Alice.
Thank you so much for having me, Hanya.
No, my pleasure. So, look, I'm really excited to have a chat to you today about your journey in medicine and the type of medicine you're practicing now. So we might start there right at the beginning. Young Alice, how did you decide to go become a medical practitioner and then go towards dermatology?
I think I always knew that I wanted to be a doctor. I was very scientific and I went through all of the things of I'm going to be a vet, I'm going to be a doctor, I'm going to be a scientist. But I think I was quite unwell when I was in high school and I spent a significant amount of time in hospital, and I decided that really I'd had quite a good experience with that in the end. But I thought, wow, this has been a unique experience for me. I was so helped, and I thought I must be able to help people in that way. At that stage, I wasn't sure I wanted to do dermatology, but that probably came later because I had my own skin journey. But I knew that I wanted to be able to help people the way I'd been helped. So I think I was pretty confident from when I was probably 16 or 17 that that's what I wanted to do. So I did all the subjects that I needed to do in year 12 and, just got the marks that I needed to, which I gather would be much harder now. And then I went straight from school to medical school, and I was the last lot of the 6-year medical degree at Monash University, which I was just so destroyed about because the next year they changed it to a 5-year degree.
Oh,
that's
great.
A bit jibbed.
Yeah, absolutely.
So I did, so I did my 6 years of hard slog at Monash University, part of which was on campus and then the other part of which was affiliated with the Alfred and Monash hospitals as clinical placements. And then I got to the end of medical school and I thought, I don't know if I really want to do medicine. It was a lot of paperwork and I wasn't seeing that many patients. And I thought, so I took a year off and I travelled the world and I found myself.
Oh, tell me about those travels. Where did you go?
I bought a one-way ticket to South America, and
that's very brave.
Pretty crazy. It was very brave. I know. And my mother was so terrified, but my mother did the exact same thing when she finished university, so she couldn't really say anything, and that would have been hairy back in the 70s. So I spent 6 months in South America, and I made lots of friends along the way, and I had a friend who had a terrible relationship, broke that up, and she came and joined me, so we backpacked around South America, had some harrowing experiences and some exciting experiences. And then I went to Europe, and I got my qualification, my medical qualification in Europe or in England, because I've actually I'm a British citizen, inverted commas, because I've got ancestry. So I have a British passport. Yeah. So I thought, this is great, this travel thing. I'll just stay. Maybe I do like medicine if I can do it in the UK. So, I did a bit of locuming and practice there for a bit, but then pretty soon I was running out of money, and so thought better come home and grow up.
Right. Oh, so good that you had a chance to sort of spread your wings and experience the world and see. I mean, that kind of learning is invaluable though, because you bring all those experiences back.
Yeah. And it really made me, exactly. And it made me realise really what I wanted to do, and really that medicine was my thing. I just needed that year to get it straight in my head. And I think I've been studying for so long. I needed the break, and I just think, it's a really good thing to do if you have the opportunity to just go and have that new time. And I had a lot of time to think about me, and I had many, I was alone often in foreign countries in a town I'd never heard of all by myself. And so you grow and you learn, and I learned so much about my own resilience, and I was like, no, I'm not going to do it. This is what I want to do.
Yeah, good on you. Look, I think that's great. We've encouraged our own children to do the same, take time off and go, because you gain a different perspective and you come back with a different focus.
Totally.
So you came
Absolutely.
back. So when you came back, is that when you applied to become in the dermatology specialty, or
yes,
did that come about?
I decided after I'd been traveling the world, I needed, I had worked in a few different kinds of medicine when I was in the UK, and I decided that I wanted a specialty that was very varied and had a lot of different aspects of medicine within one. And that's why dermatology reigns, true to me. It's very medical, it's surgical, it's problem solving, it's internal medicine, it's cosmetic medicine. And so for me, it just ticked every single box. So I didn't go straight into the dermatology training program because it was then very difficult to get onto the program, and probably more difficult now. So I did a year of research at the Royal Melbourne Hospital, 2 years actually at the Royal Melbourne Hospital, where I just worked in the dermatology department, did some research, did some general medical ward work. And then the earliest I could apply was after 2 years of that, because you have to have done your internship plus 2 years in the hospital environment, and then you can apply for the specialty program. So that's what I did. Wrote some papers, got some journal articles published, and then I was very, very fortunate to have been with a really, really good group of nurturing people that, encouraged me to do that. And I was very fortunate to get in on my first application. So I started straight away as a first-year dermatology registrar the year after that at the Royal Melbourne. And then I had a year there, and as we all do as dermatology registrars, we get, cast all around the state and the world. And I ended up back in the UK the next year in a town called Portsmouth in the south of England as a trainee, which was also very interesting. And then I came back and did my 2 further years, and then I graduated after 4 years of dermatology school, basically.
So that's 10 years of study.
Yeah.
And then there are a couple of years here and there travelling, and a pretty long journey.
If you include your 2 years in the hospital and your intern year, it's 13 years.
Yeah. Amazing. I mean, so many specialists, their journey is long. Do you know what I mean?
Very long. Oh, I know exactly what you mean. Extremely long, yes.
Yes, I know. Oh my goodness. Well, it's an amazing journey, but you stuck with it, and
yes.
Then you started practicing. So did you go straight into your own private practice, or how did you go about starting to practice dermatology?
Well, as soon as I graduated, I was pretty itching to work because I've been studying for 13 years essentially and had no money. So I was pretty keen to start working soon. So I worked for a few other dermatologists in their practices, and I probably worked, I think, at 3 or 4 different practices, and I worked at several public hospitals. And I got a feeling for what I thought that I liked and what I didn't like. And I always found it frustrating to not have a say in how things were run. And I had an expectation of what I wanted my patients to experience. And because I had no control over what the patient experience was at these practices, I was just a locum. I came in there, did a day's work and went home, and I did what I was told. I didn't feel that really gave me the greatest sense of job satisfaction or patient satisfaction, and I didn't feel I was doing it to my best potential. So after about 2 years of working for other people's practices, I decided I knew exactly what needed to be done. Well, I thought that I knew what needed to be done. And I made the hair-breaking decision to go out into private practice myself so I could create the experience that I so badly wanted for my patients to have. And, I could control the experience in the room when the patient was with me, but I couldn't control anything outside of that. The way that they were spoken to when they made a phone call to book an appointment, the way they were seen on their way out, I had no control over that. And that was the part that I felt created that full journey rather than just what was happening in the room with me.
Yeah.
So I decided after 2 years to go and start my own practice, and I was really fortunate to have found a building that was an existing medical clinic, a GP clinic in the area that I was already working in. So it was just so fortuitous that I had that, because finding a place with medical and getting a medical permit and all the kind of rigmarole of that is quite difficult. So this was kind of like a ready-made thing, and I renovated it, and 6 weeks later I was in.
That is amazing. I mean, it's so good that you were able to find it.
I know.
Yeah.
It's really hard. And I had a really great builder. And I started with just me, my best friend who answered the phones was the practice manager, the customer relations manager, the lunch maker, the cleaner. And then I had a nurse who was the nurse and pretty much did all those things as well. And the 3 of us, we had, I had no experience in running a business. My girlfriend was worked in corporate, but she had no idea how to run a business really. So it was just the three of us, and we thought, we've got plenty of time. We'll sit here for 6 months and twiddle our thumbs until the patients start coming. And then literally from day one, it was like this onslaught. Everyone had come, and we were like, oh God, we don't have any policies or procedures or anything. So
it's
baptism of fire.
Exactly what I was about to say. It sounds like you had definitely a baptism of fire. I know.
Yeah.
It must be such a shock that you go through 13 years of training and the travel, and you think, oh, I'll have to start a business and it will go slow. And I hear that so often. The biggest shock is, I think I've got a 6-week waiting list. What the heck?
That's where people like you need to come in early in the picture, Hanya, so they can get us sorted from the start. And then you end up spend all this time trying to undo things when you're busy and do things how you should have done from the start. So that would actually be one of my best pieces of advice for somebody, is get all of that at the start, because to go back and do it, I mean, I'm still writing protocols that I should have written at the start 4 years later. It's, if you have that sort of, you think you can't afford it, and you think you don't really need it, and you're going to be able to do it yourself, but we have no idea. I'm medical. I've got no idea how to, write a protocol really. So, it is really important. And in hindsight, I would have had that assistance that was sort of just managed to make it work. But it's an interesting journey.
Oh, it definitely is. And thank you. Yeah, that is what we do, is come in and get it all right from the start. But look, I must say, I've watched you and your practice grow over time, and I've known you for a long time. It's really quite remarkable, your practice, the vibe and the feel that the patient has when they enter, and what you've done with that. I think you've got a sort of a real holistic approach to dermatology, and getting that message out to your patients and the services you provide. You've got the medical dermatology, the cosmetic, then you've got things. And talk me through your vision of your version of dermatology and what your patients should get, because it's amazing. It's a really comprehensive service.
I've got a bit of a holistic twang to me. Generally, as you said, I practice yoga and I meditate, and I'm very into soul searching, and so I've got that sort of weird side to me, and I think
it's a fantastic side. No weirdness about that.
I'm kind of a bit eccentric, so I feel that there are certain patients who need that approach to their skin. It's not just a case of coming and having a skin check and off you go. So my approach is treating the skin and the person, and treating the patient basically treating the patient as a journey rather than just a patient interaction. So I love the idea of being able to create an experience for somebody where they feel totally well looked after and nourished at every step of the way. As I said, from the moment they call to make the appointment, the moment they step in the door, the moment they're followed up. And part of being able to create that experience for people is having a sort of one-stop shop. And, our patients really appreciate that you can come here and have your skin check, and one of our dermatologists could cut out your skin cancer, or you might need a plastic surgeon. And so you could see our plastic surgeon, Sophie, who comes here, or you might need some laser for your capillaries. So you can see one of our dermal clinicians, and I'll be able to direct the dermal clinicians as to how to treat you. And then you might need a wart treated by our nurse. And so I guess everything is very collaborative, and I know my own experience when I've had a good experience has been a collaborative approach where sort of every aspect of care is being attended to. And, we try to make it nourishing and soothing as much as we can, because I think that everyone is, particularly if you have a skin check, you're often very anxious and stressed about it, even if there's nothing wrong. The whole thought of it can be a bit overwhelming. And so being able to create an environment for people that is soothing and relaxing rather than very clinical, I think, is part of the therapy for me.
Yeah, and look, I think that one-stop shop, the collaboration between different specialist types to meet the patient needs in that sort of the scope of what the service you're providing is absolutely what's needed. And I do know that just looking at one thing you're really good at, actually, I might touch on this, is your social media presence. And how did you? We might actually go on to that, the social media. And how did you bring that in? Because that's quite,
it's very
something that started when you started in medicine. It really sort of started to take off, and you were an early adapter. I suppose that's what I'm trying to talk about.
Yes, I was. And I had a lot of criticism for that back in the day by some, pretty well-known dermatologists and people in the industry, I think I first started my Facebook page, because this was before Instagram was a thing. I first started a Facebook page when I was probably a registrar, and it was called The Skin Doctor, and I just posted information about things that people would ask me about that I couldn't believe that they didn't know.
Yeah.
You know, like what's a moisturizer and what's in a moisturizer, or, you know, just silly things that I took for granted because I knew, but I realised that the common person had no idea about the differences in moisturizers, and, you know, skincare wasn't really a huge thing back then. So I sort of started to pick apart some actives in skincare and, you know, what psoriasis and what the treatments are. So I sort of started doing that, and I got quite a lot. This was before I graduated as a dermatologist. I copped quite a lot of flack for it, actually. And I thought, well, what am I really doing wrong? Like, I'm educating people, and I think that that's really important. And these are common questions I get asked. So I sort of I got upset about that for a few minutes, and then I moved on. And gradually I realised that it was gaining traction. So I realised it was a really good way of communicating with people, because I can't see everybody. And to communicate with people, I think, is really important, and knowledge is key. And I think when people will be less worried about coming to the dermatologist, or they'll be more educated, then that can only be good for the community, for people to know those things. And as anyone who's worked with me before will know, I love teaching and I love giving tutorials, and I teach our staff all the time at every opportunity. So being able to relay information, I think, was really the way that I got into it.
Yeah.
And then, of course, you now realise that social media is an important part of your marketing campaign. I mean, we don't do really any marketing as such. I just run an Instagram account, and that is our marketing. But you pretty soon realise that you get this following, and then I was getting people asking me, saying, oh, well, what about this and what about that? And could I come and see you? And then I realised, okay, well, this is marketing. This is actually called marketing, I think.
You've done really well. You've got on to something earlier, done really well.
I did 101 in marketing without even realising.
Yeah.
And I thought, okay, so then I thought, you got to change how you say things a little bit when you know it's that forum, but it became pretty apparent to me that was a way to reach people.
Yeah.
And I guess in some ways get customers get clients into the clinic. So, you know, we've got a lot of restrictions in what we can and can't say on social media and medicine, which is absolutely ridiculous. And that is one of my big bugbears about saying medication names and, you know, all this stuff. We've got to talk secretly about things, which is not a good feed of information to people. So people will get their information from overseas, like in America, you know, look, Roaccutane, for example, which, you know, I'm mentioning a brand name, but it's a really important one in that we can't mention that in Australia. So patients aren't getting good information. So they'll go and search overseas where they are allowed to say those things, and they might get not good information. So
especially because FDA and the TGA, different rules. So
totally different.
You know,
totally different. And getting your head around all of that is, you know, and that wasn't a thing when I first started in social media, and it's become a thing now, but it's complex now. But, you know, I think I sort of enjoy that part of it because it appeals to that educational component in me, I think.
Yeah. Now, I think it's been a really good tool for you. And I think the reason I segued to that is that's where I've been watching, apart from knowing you and working with you, or socialising with you and over times, or being I've been watching your journey. So your story, or the kind of doctor you are, the things that I've sort of seen is the yoga or nutrition, the holistic, which I think's really amazing, because how do you get that message to everybody if it's not through that sort of social story? But maybe that we can talk about that dermatology on the outside, but I know you've got a big passion of dermatology, is it the right term, but coming from the inside out as well?
Yeah, I guess that encompasses almost every consultation that I do and I have. You know, we're quite well renowned for sort of thinking outside the square and looking at how things could be contributing, or, you know, prescribing a dietary change or a supplement to help with your skin cancer, or, you know, we sort of just look a bit beyond. And I guess in dermatology, there's a lot of things that manifest in the skin that are internal, but then there are also things that you can do internally to help with your skin manifestation. So we always touch on those things with most of our patients, because I think even though a lot of it may not necessarily be clinically proven, it's certainly anecdotally from my own experience, and I will always tell patients that it's anecdotal. I've seen success with things that you just wouldn't expect would be successful. And it even comes down to small things like we we inject a local anaesthetic here, and every time someone gets a local anaesthetic injected here, they say to me, I've never had an injection that doesn't hurt. Why does your injection not hurt? And I say to them, because I make them breathe. We do yoga before they have their injection. And I make them concentrate on breathing in through their nose, out through their mouth, which is a yogic principle. And instead of being all uptight and worrying about when the injection's coming and holding their breath, they are breathing and they don't even feel it. And it's such a simple thing that you just think, gosh, you know. So we try to incorporate just sort of some practical and I guess more natural approaches to things. And I think that just creates a better, a better experience and outcome.
Yeah. I think
diet's a big thing we talk about too, as you said. So, yes.
Yeah. Look, I really admire that, because especially now everything's about, it's not just the physical, it's your mindset, it's the whole, which is really great. No, I really think that's fantastic. And where do you see this all going in the future though? How is this sort of area going to evolve, do you think?
Well, I don't know. Most dermatologists we're pretty like, archaic bunch most. So I hope that, the old school mentality of medicine in general, I hope changes. I look at some of the specialists that I've seen in my life of things I've had, and a lot of these old school, not at all focused on customer service, not at all focused on the patient experience. I think medicine as a rule is going to change a lot. And I think the young consumer, and we're seeing it first in our industry because we do cosmetics and we've got a young consumer, and we've had to adapt. Most cosmetic clinics or dermatologists do cosmetics have had to adapt because we're seeing it earlier in that generation, but that will filter through to every specialty. You won't be able to, have a shocking bedside manner and take a phone call in the middle of a consultation, and you just won't be able to do those things anymore, I think. Nor should you. Like, I think a patient deserves your time. Like I went to a specialist the other day and he took 4 phone calls, kept me waiting 2 hours, and took 4 phone calls in our consultation in the room, and I could hear everything that was being said. And I just thought, no, my patients wouldn't cope with that. And I've got a big rule. I'm like, no one is allowed to interrupt my consultation with a patient unless the building's burning down. And even then, it'd have to have burnt every other room except the one I'm in. Like, I'm very, very particular about that. But I think that will evolve. I think it has to.
It has to. I think there was a generation where the patient or the client sort of just did as they were told and said, we're going to the expert. But because they've got access to so much information, quite often they've decided who they want to see prior to seeing them, and their referral from the GP or making that contact is the other way around. They're just they're demanding what they want and what quality they want and what they want to happen. That sort of customer service is absolutely 100%. You're right on track there. Shocking. Some of the things that still go on. That's another story altogether.
I know.
So, Alice, you sort of touched on that you like yoga and doing other things. So what is it? What is the other half of you that keeps you sane, does not work? What do you do? What's Alice Rudd out of work?
Well, pre-COVID, I do like to travel. And I go anywhere. I mean, at the moment I go, 25 Ks to get to Frankston or where honestly, at the moment I go anywhere from restrictions, there's nowhere to go. But I love, as I said, my year away really taught me I love experiencing different people, new environments, and that's very inspiring for me. I find I get very stimulated in a new environment where I learn more about me and about somebody else. So I love traveling. I do yoga, as you said, regularly. I have a dog and I walk her twice a day. Love my walking around the town.
What kind of dog is she? What have you got?
She's an Australian Shepherd. So she's like a border collie. She's divine. She's 12. I got her when I got back from my year overseas and my travels. I wanted to nest and settle. And so I'm a big walker, and I often would walk with different friend every day. So I guess, I cook now. So I don't know. I haven't had lots of time in the last few years running a business to do extra things, because you're here working, but then every hour afterwards you're doing something for the business. Yeah. But now that seems to be settling, I'm finding more time to do things. But I love travel. I love yoga retreats. Love yoga full stop. And family time when I can.
No, good. it sounds like you're working your way towards a good balance working. Like, I don't know that there'll ever be a good balance. I'm sure it'll always be an 80-20, especially if you're running a specialist practice.
Yeah, I've come to that realisation.
So, Alice, you know, if you were to impart some words of wisdom to from your journey in becoming a dermatologist and looking back to early days, is there any words of wisdom that you'd like to share at this point?
I think one of the biggest lessons I've learned, and this is probably more, I think from a dermatology point of view, I think it's very important to focus on the patient, not the disease. And that sounds very cliche, but you know, the feedback I get from my patients all the time is that, you know, I do focus on them, and we all have a lot of patients and things, but I think if you focus on the patient and their story and their journey, you actually get back so much from them. And I feel that connection with my patients is something that I've really learned, which I didn't know in the first, year of my private practice. I didn't realise the importance of that. But if you want to do this job for a long time, I think you need to have that connection with people, because you want to keep coming to work and you want to grow and you want to learn and I learn things from my patients all the time. So it's not just about the skin check, but it's about getting to know the person. And we're very lucky in dermatology that we get to follow people most of the time for their life. And I think from a business point of view, and this is probably just a life point of view as well, and I think it probably, actually, even if I didn't start my own business, learning to let go a little bit is important. I think most doctors are very type A. We get very focused on everything being perfect and being right. And I think that can be debilitating, because not everything is perfect and not everything is right. And you can control everything, when you study, when you sit your exam, there's so much in your training that you can control. But when you're not in that environment anymore and you're in the real world and you're seeing patients, there's so much you can't control. And one of the biggest lessons I learned was that not everything's going to go perfectly. And not every staff member is going to do what you want them to do when you want them to do it, like you would do it. And, you have this very high expectation of yourself and therefore people that you work with, which in reality probably isn't very practical. And it's been a really huge thing for me and very confronting to have to kind of accept that things won't always go according to my plan. And I think, a lot of doctors are in that sort of, that this is a type A personality, perfectionism trait, but I've learned the hard way that it doesn't always go how you want it to go. And it's confronting when you've done it for however many years, most of your life, to change that mentality.
Yes, it's all about the mindset. Yes, and a big, big flip there. From those studying to do what you do, and it's, as you say, it's quite structured, to having to change your mind frame to be a business owner and a leader. Very interesting. Well, yes, good advice. All right. Well, Alice, I'd like to thank you for your time today. I'm looking forward to seeing you again at
Yes, hopefully.
Somewhere. Maybe in the Qantas line again when we're travelling.
Perfect.